Good morning, everybody. I wanted to have a 10 minutes discussion with you about the need to transfer from pure healthcare to health. I fell in love with the healthcare industry or the healthcare services a bit more than 4 years ago. Had the idea originally about then founding a company, a new fresh company to the industry, which I considered as a client at that time, having big players that were quite conservative, and we wanted to bring them fresh ideas and a bit of rock and roll to the market. What we did then in the first place, before doing anything else, was that I interviewed a bit less than 100 business leaders about their aspects in the services they are buying. And there was two issues which came in almost all of the discussions. First of all, one was that people were, they say that they would like to have more preventive health services, and they felt that what they were provided at that time was purely then sickness care. Then there was another issue as well. It was that they said that they are frustrated because of the opposite motivations of the players there. The traditional healthcare service providers, naturally, the more they treat sicknesses, the more they sell appointments and so on, the more they make money, and the less good it will be then for the clients. So they felt that the common interests there were then missing from the industry. As a result of those discussions then, we brought to the market a new business model, then in practice being the same as in the ancient Chinese villages. In the ancient Chinese villages, the business model of the doctors was not that they were charging based on appointments or procedures. It was so that all the healthy people were paying to the doctor. So the doctor's incentive was then to keep the people healthy. The more healthy they were, the better the doctor was also off, and vice versa. We then started thinking how to bring that back to the Finnish market in the 21st century, and then established a fixed fee business model, then combining well-being services, preventive health services, and then also sickness treatment. And today, our motivation it's in two different places, which are interesting from this morning's discussion's point of view. First of all, we have a real business incentive now then to prevent people from falling sick. And then, in addition, we have also strong motivation to bring to the market new ways of then treating sicknesses. And as a result of that, we've been then using actively different digital applications also both for preventive services and then for sickness treatment. And based on our statistics last year, for example, 76% of all the activities in sickness treatment were done from distance, either with digital services or then with telemedicine services. A few years ago, I was visiting Health 2.0 event in California, and there I was really impressed by Mr. Bernard J. Tyson being the CEO of Kaiser Permanente, a large insurance company owning hospitals and so forth in America. And what he was then saying there that let's stop discussing healthcare and start focusing on health. And he also then said there on stage to a few thousand people that he intends not to retire until there are people working in the business life of America with the life expectancy of more than 100 years. And I'm so sick about the public discussion about the social and health reform in Finland at the moment. Where do you see these kind of opinion leaders here at the moment? We are just discussing the administrative issues and taxation and so on, but how about the client perspective and preventive services and the issues we could then be really affecting our life expectancy? What does then this mean in practice? We are used then, when we are talking about healthcare services, we are then really discussing reactive healthcare. Everything then begins with a person himself or herself then identifying something being wrong, then contacting the service provider, after that then going to a hospital and then enjoying the services there. We believe that also the services should be really different. this is a living example about Heltti services, then our healthcare professionals then playing beach volley with our clients. I'm sure that this will then encourage the well-being much more than most of the traditional services. Naturally, then also you have to do also something else than play beach volley in healthcare services. But then there is a really interesting question when you are then starting to provide these kind of new services. What kind of KPIs and what kind of metrics can you use there? When I discuss with the business leaders about their health KPIs, I think that there are two which they can mention every time. One of them is the sickness leave percentage, and the other is the costs of the sickness treatment they are using for their employees. When you then think about preventive services, you cannot then apply either of those. And then still going forward, we have a lot of scientific surveys that show the correlation between well-being and productivity. We know that all the companies, they manage and they lead their productivity in a really professional manner, but how about then leading then and managing the health and well-being of their employees? It is not possible if you're just looking at the sickness leave percentage and the costs of the services. You need really new kinds then of metrics to be used in managing health. And then as example about those metrics we are using in Heltti at the moment, we have around 5,000 people using our services in a bit more than 300 different companies. And what we are monitoring about them is, first of all, we see that life expectancy is a really interesting metrics to managing well-being and preventive healthcare. And I've quite many times said that actually we are not in the business of providing healthcare services. We are in the business of providing additional healthy living years to our clients and to our members. And then other issues we are then monitoring at the moment is then, for example, sleep, the quality of sleep, the quantity of sleep, and in addition we're measuring stress levels. We have been then organizing also activity campaigns to the corporations using our services and to their employees. And at the moment we are at the stage where we have the technological readiness then to take in this information and to use that as a part of our services. And it's really interesting to see what happens when you are combining then the traditional patient information with this new kind of well-being information. And how I see then Heltti developing in the future is that, for example, we have had a project where we have investigated about the idea that if our members are using a smart wristband, then measuring activity and measuring heart rate and so on. And then based on three issues, first of all, daily activity going down, then in addition, quality of sleep going down, and then simultaneously heart rates going up, we see that as a red flag for the risk for burnouts being then increased. And what we want to do next is we will turn the way how you communicate with the healthcare professionals. You do not have to yourself identify that something is wrong, but how about if the healthcare team would be contacting you when they see that there is something that should be then reacted on based on your well-being data. And then what is my one objective for today is then to get to know interesting different kind of digital healthcare application service providers here, those kind of applications and measurement devices and so on that could then also be used as part of Heltti services. And I would like to then to close my speech here by then quoting a part from a book that has then made a huge impact on myself. And it says that if you want to know how your company did yesterday, look at the financial statements. If you want to know about today, look at your customers. But if you want to know about tomorrow, then look at your employees. Thanks.